So this, Dr. Corey Maas, on looking your best again. This is one of our hair cases. This is a person who's had actually cranial surgery before, and there's a scar right down the center here that we're going to be completely obliterating by placing hair grafts in it. Now you see my pattern that I have under here marked with very carefully into boxes. That gives me a number of square centimeters that I'm going to be grafting. And you can see already along here I've got my nice density in the frontal hairline, and as I work back here I'm going to make sure that we've got good density, because he's got reasonable density in between here, but I want to make sure that when he parts his hair he's not showing scalp. So we're going to work on grafting along here and in this segment here in the box, and get really some more density here, so that from his natural part, this is about where he parts his hair, right in here, that we've got excellent coverage of the scalp. So the key to this is really making sure we understand what the patient's desire are, and for him he wants to have very little or minimal scalp showing, and then I've created these little 1 square centimeter boxes, knowing that I can get in somewhere between 20 and 30 grafts per centimeter, sometimes as much as 35, depends on the scalp, squared, and that gives him a nice full dense thick head of hair as we finish. So we're well underway with this. He's very comfortable, and we'll be working on increasing the density along this part in the area where he comes over, and there will be no, as you can see here already with his nascent hair and with the graft sites that we've already created, there will be no bald areas whatsoever. He won't have a comb over hairdo. He'll have a natural hair style. These grafts are cut into follicular units, which are 1, 2, or 3 hair units that are the graft themselves, and that's how our hair grows naturally. So we'll be focusing on that and focusing on making sure that this density is fully covered. My technicians are in the other room. They're working under microscopic magnification to cut those follicular units, and we're placing these with tiny little cuts that are made with this. This is basically I modified a 19 gauge needle, one that you use for injecting someone with local anesthesia, and I'm going to place these little slits where they're needed in each one of these little boxes. And I've done my count, so I know how many we need to place. I know how many we need to get in here, going for that maximum density range at about 25, 35 grafts per centimeter, and I'm going in between the existing hairs here to save every single hair follicle and every single hair shaft, not just the ones we're transplanting, but the ones that are already existing. And you can see I'm angling this so it helps to accentuate his natural part. So that's really the strategy in hair grafting, and for every person it's different. It depends on their style, it depends on how many grafts they want to place, what their investment is, and then we're doing this as simple math. I'm just sitting here counting each one of these as I place them very carefully between each hair. Now I'm working right along his part side, and you can see that the hair goes in different directions, so I'm altering the direction in which I'm making the little slit to accommodate that. We'll have tiny little, I've injected this with a very nice sort of combination of local anesthesia with a little adrenaline in it, which helps to make sure that you just get little tiny pinpoint areas that bleed. You really just don't have any bleeding on these things at all. And while I'm talking here, I'm also counting, so I'm working very diligently on making sure that the hair density right along his part is perfect. I want to make sure he's got excellent hair density along his part. So that's really the key to the grafting, is proper placement of these little tiny slits. And then ultimately we're going to be placing each one of these little micrografts, and once these start growing, you can't tell the difference between these hairs, the hairs that I've placed in these little tiny slits, and the natural hair that's growing on his head right now. So I'm saving every one of his natural hairs by carefully placing this between those little hairs. Painstaking, time-consuming, diligence, sort of going for really perfect, perfection, accuracy with the placement of these, with each single hair, and that's really the key to a natural and really long-lasting, thick-headed hair that people will appreciate. This hair will never go away. The transplanted hair is hair that's genetically programmed to be there forever. So people who do this really are making a great investment for their whole lives. They're going to have this hair forever in the density, and very, very nice procedure. Comfortable, easy. The recovery for this procedure in this patient will be, he'll wear a hat leaving today, and with a hat on you won't even know he had anything done. It'll be a little red on his scalp and the forehead for a few days, and outside of that there's really no recovery. He'll be showering in a couple days normally, washing his hair. I don't have him blow dry it or run a comb through it, but he can wash it normally and towel dry the hair by patting it, and he'll be doing little spritzes with water to keep the hair nice and soft and moist, and that's really the only recovery component that he has for the next 4 or 5 days. By 2 weeks, even by a week, we're really back to normal activities with this procedure. If you're interested in more information on hair restoration, hair grafting, microfollicular unit extraction, that's also called FUE, please don't hesitate to reach out to us at drmaas.com. You can go to our website at maasclinic.com. And as always, you can reach us at our phone number at area code 415-567-7000. This is Dr. Corey Maas on Looking Your Best.